oxygenated blood enters the heart via the right atrium. Again, the atria contract, forcing the blood into the right ventricle. Much like the left side, there is a valve preventing backflow. This valve is called the tricuspid valve because it has 3 sides. When the ventricles contract, the blood is forced out of the heart up to the lungs. Diffusion takes place. We drop off the CO2 and pick up the oxygen ready for another cycle. So far, we know the names of the 4 chambers of the heart, 2 valves, and we understand the route blood takes around the body. We just need to add the names of the blood vessels involved and 2 more valves. This should also serve as a bit of a recap. The first step of the journey was from the lungs to the heart. We were on the way into the heart, so the vessel must be a vein. This vein was leaving the lungs, so is said to be the pulmonary vein. Pulmonary is Latin for lungs, so anything lung related is often said to be pulmonary. Next, we entered the left atrium and then the left ventricle. On the pump of the left ventricle, blood leaves the heart via the main artery, called the aorta. Between the heart and the aorta is the aortic valve. Again, this valve prevents the backflow of blood into the heart. The blood travels around the body, delivers its oxygen, picks up the carbon dioxide. Now this needs to be taken back to the heart. The vein that delivers the blood back to the heart is called the vena cava. The superior vena cava delivers the blood from the head and chest, while the inferior vena cava delivers the blood back to the heart from the lower body. The blood enters the right atrium, is forced into the right ventricle, then is pumped to the lungs in our final blood vessel. The blood is leaving the heart, so the vessel must be an artery. It's heading to the lungs, so we have the pulmonary artery. This also brings us to the final valve we need to know, which separates the right ventricle from the pulmonary artery. This is called the pulmonary valve. Both the pulmonary valve and the aortic valve are sometimes referred to as semilunar valves because of their half-moon-like shape. The final 2 terms to add on refer to this almost figure-of-8 system where the blood is pumped to the lungs or the rest of the body. The flow of blood from the heart to the lungs and back is known as pulmonary circulation, while the flow of blood from the heart to the tissues of the body and back is systemic circulation.